Laminectomy, a detailed explanation. A laminectomy is a surgical procedure that removes a portion of the vertebral bone called the lamina. The lamina is the back part of the vertebra that forms a roof over your spinal canal. Analogy: think of your spinal canal as a tunnel and your spinal cord and nerves as the traffic running through it. A laminectomy is like removing the roof of the tunnel in a specific area to give the traffic, nerves, more space and relieve pressure. The term itself can be broken down. Lamina, the specific part of the vertebra being operated on. Ectomy, a medical suffix meaning to remove. Why is a laminectomy performed? Indications. A laminectomy is primarily a decompression surgery. Its main goal is to alleviate pressure on the spinal cord or the nerves that branch out from it. The most common reason for this pressure is spinal stenosis. Key conditions treated with a laminectomy include spinal stenosis. This is the narrowing of the spinal canal, often caused by age-related wear and tear, or osteoarthritis. Bone spurs, or osteophytes, and thickened ligaments can grow into the canal, squeezing the nerves. This is the most common reason for a laminectomy. Herniated disc, or slipped disc. While a discectomy, removing the disc material, is the primary procedure, a laminectomy may be performed at the same time to give the surgeon better access to the damaged disc. Degenerative disc disease. As discs lose height, the vertebra can shift and ligaments can buckle, causing the spinal canal to narrow. Spinal tumors, to remove a tumor growing on or near the spinal cord. Spinal injuries or trauma, to relieve pressure caused by swelling or bone fragments after an accident. Arachnoiditis, painful inflammation of the membranes that surround the spinal cord. Symptoms that might lead a doctor to recommend a laminectomy often involve nerve compression, such as pain that radiates down the leg, sciatica, or arm, radiculopathy, numbness, tingling, or weakness in the legs, feet, arms, or hands, difficulty walking or maintaining balance. In severe cases, loss of bowel or bladder control. This is a medical emergency. How is the procedure performed? A laminectomy is performed by an orthopedic surgeon or a neurosurgeon, usually under general anesthesia. Preparation. You will be positioned face down on a special operating table that allows your abdomen to hang freely, which reduces pressure on the veins in your back. Incision. The surgeon makes an incision over the affected vertebra in your spine, cervical, neck, thoracic, mid-back, or lumbar, low back. Muscle retraction. The back muscles, paraspinal muscles, are carefully moved aside to expose the spine. Lamina removal. Using specialized surgical instruments, the surgeon removes the lamina. This immediately creates more space in the spinal canal. Any bone spurs or thickened ligaments that are contributing to the compression are also removed. Addressing the underlying issue, if the surgery is also for a herniated disc, the surgeon will now have a clear view to remove the protruding disc material. Closure. The muscles are moved back into place, and the incision is closed with sutures or staples. Variations of the procedure. Laminotomy. A less invasive procedure where only a small portion of the lamina is removed to create a window to relieve pressure, rather than removing the entire section. Laminectomy with fusion. If removing the lamina makes the spine unstable, the surgeon may perform a spinal fusion at the same time. This involves joining two or more vertebrae together with bone grafts and hardware, screws and rods, to create a single solid bone. This is more common when multiple levels are operated on or if there is pre-existing instability. Recovery and rehabilitation. Recovery varies depending on the extent of the surgery and the patient's overall health. Hospital stay, typically 1 to 3 days. You will be encouraged to walk within a day of the surgery. Pain management. You will have pain from the incision, which is managed with medication. The nerve pain, like sciatica, often improves very quickly. The first few weeks, you will have restrictions on activities like bending, lifting, and twisting. A back brace may be recommended. Physical therapy is a crucial part of recovery. A physical therapist will teach you exercises to strengthen your back and core muscles, improve flexibility, and help you return to your normal activities safely. Full recovery. It can take a few weeks to a few months to fully recover and feel the maximum benefit of the surgery. Risks and complications. Like any surgery, a laminectomy has risks. General surgical risks, infection, bleeding, blood clots, and adverse reaction to anesthesia. Spinal fluid leak. A tear in the membrane, the dura mater, that surrounds the spinal cord can cause spinal fluid to leak. It often heals with bed rest but may require another procedure to repair. Nerve damage. There is a small risk of damage to the spinal cord or nerve roots during surgery. Spinal instability. Removing the lamina can sometimes make the spine less stable, which might require a spinal fusion later. Failed back surgery syndrome. Some patients may continue to experience pain after the surgery. Success rate and outcomes. A laminectomy is generally very successful, especially for relieving leg pain or radiculopathy caused by nerve compression. Success rates for relieving this type of pain are often 80 to 90%. It is typically less effective at relieving chronic back pain itself, as that pain may be caused by arthritis or muscle issues rather than direct nerve compression. The primary goal is to treat the radiating symptoms of numbness, weakness, and pain in the limbs. Disclaimer: this information is for educational purposes only. If you are considering a laminectomy, it is essential to have a detailed discussion with your doctor or surgeon about your specific condition, the potential benefits, and the associated risks.